Today on Education Forum, the impaired professional, their impact on others. From the studio, high atop Jordan Hall in the College of Education and Health Professions at Columbus State University in Columbus, Georgia, this is Education Forum with your hosts, Jeff Conklin and Greg Blaylock. Welcome to Education Forum. I'm Jeff Conklin with my co-host, Greg Blaylock. Good morning, Greg.
Good morning, Jeff.
I'm doing well. How are you?
All right.
Good. Today's guest is a man that we had on the show it's been 2 years now. I was just looking at the record. And he was on about 2 years ago, and we were talking about, at that time, a show we called The Impaired Professional. We were talking about the shooting at the University of Alabama, Huntsville, where a university professor shot some of their colleagues. And so I'd like to welcome to Education Forum Professor of Counseling Education, Dr. Mike Baltimore. Welcome, Mike.
Thank you, Jeff. It's my pleasure to be here.
It's good to have you on today. Now, a year ago, we were talking about the impaired professional.
Yep.
And today we're going to take that a little further.
Okay.
And I thought maybe we could talk about the impact of that professional on the people around them. So when we're talking of an impaired professional, what are we saying? What are we talking about? Or who are we talking about?
Well, it's an interesting area, but first let me just thank you guys for allowing me to be on here. This is one of CSU TV's ongoing shows. It's been around a long time, and both of you guys have done just a wonderful job here. So it's my pleasure to be here and even take a little small part in this show today.
Thank you.
The impaired professional is a very interesting topic because when you look at the literature and look at the definition of it, it really seems to move toward things that are related to substance abuse,
okay,
drug-related, alcohol-related, and that impaired professional, meaning someone having a substance abuse problem in a general sense. And occasionally, after that, people talk about depression and anxiety. So
okay,
an individual at a workplace experiencing depression, anxiety, maybe some other things. But there's another part of this that is really I'm interested in particular, and that is the effect of some of the other mental illnesses as defined by the Diagnostic and Statistical Manual for the American Psychiatric Association, and those mental health categories that actually impair a person at work and also the members of that team and those people at work, the other employees and the
okay,
colleagues. And so we don't hear too much about that, actually, and it's been an interest of mine for a while. I've looked into the literature and really tried to understand how this is taking place. If someone has a mental illness, as defined by the DSM-5 now, what is the impact on the others around them?
okay,
Because
okay,
a lot of times the literature will look toward the person, and it's a very linear viewpoint or perspective, meaning that it's within the individual.
okay,
The individual has the problem, and that's where treatment and people recognize it, and they point the finger and say this person has an issue, or a colleague or another employee or manager or others, they have a problem, and it's contained within that individual.
okay,
Well, there's
okay,
more to it.
okay,
It turns out that that person suffering through some of these issues are also impacting those around them.
So it sounds like I'm hearing you talk about really similar to the literature around people who are alcoholics or drug abusers and the effects on their family and friends,
Right.
In that same way.
Right, and in this area, it's really I don't think you hear about it. I don't think you hear too much, and it's not defined. I don't think obviously there's an awareness issue here, for people, and not a lot of people are spending time getting training in mental health issues
right.
and treatment and those kinds of things. So, but I think it's significant. It has a huge impact. We know overall that the impaired professional will have financial a financial impact on the productivity at work.
Sure.
There are lots of things that fall into place when a person is dealing with mental health issues. And so what I want to do is just talk a little bit about a little more specific area within the impaired professional, and that really is how it impacts those around them.
Okay. Before we go any further, you used a term I thought maybe we ought to clarify.
Okay.
Before we go any further, you said DSM.
Right.
And for those out there, what are we talking about when you say DSM?
Yeah, that's a good point, and I'm glad you brought us back on that. The DSM is the Diagnostic and Statistical Manual, and this manual is prepared by the American Psychiatric Association, and it's used throughout mental health centers and in other places, hospitals, clinics, and so forth, to diagnose and therefore then to treat people with mental illness. The DSM, or Diagnostic and Statistical Manual, is really a classification of mental disorders.
Okay.
So it's a wide-ranging system of categorizing anxiety, depression, schizophrenia, serious mental illness, all the way to the less serious, which some people refer to as adjustment disorders. Those things that we go through in everyday life, where it's short-lived and we're able to endure it, all the way up to those serious mental illness that are lifelong. So this categorization system allows us then to prepare treatment, to understand what the symptoms are, to kind of understand what's going on with the individual and how it affects others around them.
Okay, very good, very good. Now, before, when we talked about impaired professionals, we talked about alcohol, we talked about substance, we talked about the impact on the employer, we talked about salvaging the employee, or curing them, or supporting them.
Right.
Now we're talking about their impact on others. And can we take that a little further? What do we mean with that impact? What could that be?
Well, you know, my training as a licensed professional counselor in licensed marriage and family therapy, particularly, we tend to see things from a systemic point of view and a systems point of view. What that really means in terms of what we're talking about here is that the individual is not isolated by themselves. They're in connection with others, their family members, their colleagues. And if you look at it from a contextual point of view, this begins to go out like a ripple on a pond when you throw that rock in there, that it does have an impact on a larger and larger system in terms of just that workplace, as we're talking about here, but also back out in the community and in a larger perspective of all this. So I think that we haven't spent enough time on this, and I'm happy to talk about it today, that there are some of those issues, and we can begin to understand, because what goes on with these individuals experiencing mental illness, and therefore be a little more prepared and certainly more aware that there are opportunities to help this person, but there's also opportunities for you to understand and protect yourself against these kinds of issues, because there is an impact to the individuals around them.
Okay. Can you give us some examples of this?
Well, we obviously, we were talking before the show about the alcohol, substance abuse issues, where you see the person, if they've been drinking or using a substance, then there's impaired behavior. It's easy to recognize. For the most part, it is. It may take time, obviously, for that to come out and there be a serious impairment in terms of functionality.
Okay.
But this is a little different. This has to do with how a person deals with other people in relationships.
Okay.
This has to do with whether a person has attachment type issues. These are, and we can talk about this, and I'll try not to go too long into this, but the notion of a person having a disorder that is long-term in nature, that goes across and cuts across situations and people, over a period of time.
Okay.
Now, in particular, we're talking about the personality disorders, and these are long-term in nature. These type of disorders and the symptoms that you see around this over time with different people, a tendency to repeat these patterns with others. So I guess what I'm saying basically is that a problem within the person is also a problem on the outside with others.
Okay.
And that's what I wanted to kind of take a
What would
look
be
at
an
today.
example of a personality disorder and its impact on a colleague or management? Or can you give us a concrete example of that?
Sure. You know, one of the things that we know about a personality disorder in terms of the definition is it may be an average or above average intelligence. These are
Okay.
persons who are not who are intellectually fine.
Okay.
Actually, so they may have had a successful academic career. They may have had even a successful employment career, and they may even move up in the ladder or in the chain of command in an organization or an institution.
That's right, because mental illness has nothing to do with intellectual capacity.
That is very, very true, and these are the type of issues that you would assume that the person can work through and work out and be okay and figure out how things work in interpersonal relationships. However, this is where the impairment is. This dysfunction is really in relating to other people, building healthy relationships, and then continuing healthy relationships because of some of these symptoms that are connected to the personality disorder.
Now, are personality disorders really mental illness, or is it the way a person is?
Well, that's I like the way you define that, because actually what you know, this is not a deductive process where you go back as a detective to find the source of when something happened.
Okay.
This is in terms of a person's development over time.
Right.
Now, there are a number of theories out there that would try to answer that question that you posed. And there are certain theories that look at the past and the early development, such as I mentioned, attachment disorder, John Bowlby, Ainsworth, all of those people who studied those kinds of processes that say, and the Freudian-based, obviously,
Yes.
theories that say something happened early in childhood, something happened in that developmental process that was blocked or interfered with, or that they didn't get the nurturing. There are some problems along the way that caused things to happen throughout a process over time.
Right.
And
right.
that, I think, and some of those are well thought of, and the literature supports some of those. So it really is not something necessarily that is learned or something that is biological, but something that is both.
Okay.
In those ways.
Okay.
So
Developmental, I guess, would be
Right.
a word to describe how that happens.
I think so, because there's obviously going to be something in the environment, the impact of the others that have or surrounding significant others. I think we were just putting up a slide here. I wanted to go to those slides
Good. Let's do that.
and talk a little bit about it. If we can pull up that first slide. We're taking one of the personality disorders, and we're looking at them, kind of breaking it down just briefly here. This is the borderline personality. And we won't go through all of this list, because there is an extensive list here that looks at symptoms, but just looking at this first slide, we see that the typical features involve the instability of self-image. These are people who are not really stable in the way that they see themselves, their personal goals, but importantly, the interpersonal relationships and the affect surrounds that can be seen as impulsivity, hostility, risk-taking behaviors. These are the kind of things that I believe affect the interpersonal relationships that a person at work or in other institutions, and even universities, as well as business and other places.
Okay.
So, and I cut into this slide too. You see the numbers 2 and 3 there.
Yeah.
This is a particular category where there are 4, and one of the things that the DSM does is to look at symptoms, and sometimes they'll list symptoms and say, if your patient has 2 out of the 4, or 5 out of the 7, or 3
Okay.
out of the 7,
Okay.
those kinds of things. So let's take example this one, self-direction. You know, the aspirations and goals, somebody could be okay with that as they move up intellectually. But number 3 is an interesting one. This is a symptom that regards empathy and issues with empathy. So there is a compromised ability to recognize feelings and the needs of others in this interpersonal relationships. There might even be a hypersensitivity, so that the person feels slighted or insulted by something that normally you would not think to be true. And perceptions based on this selective bias of negative attributes and vulnerabilities. So what you see here is really an imbalance, a dysfunction in this regulatory process that most of us have, hopefully, who are working. I mean, we may all have issues, as a number of people written about in the literature, but our trajectory towards interpersonal relationships is such that we can support one another, we can work through problems, we can be honest with each other, and maintain really good mental health in the environment that we're working in, particularly, or even at home. But that slide was basically saying that there's a tendency toward dysregulation of the affect and sort of sliding toward seeing things in a negative perspective and feeling insulted or wounded, and then becoming angry, and then coming back at people. Now, here's another slide here,
I just have a question. That
Sure, come on.
Now, when
We
you're
come back to
talking that
that.
way, are we talking about people that, in their relationships with others, they take it very personally when it just could have been a disagreement?
Right.
Okay,
Right,
so
that's an
rather than having
example.
that healthy disagreement that people
Right.
have and then coming back at it, they take it as a personal attack.
Yes, that's exactly exactly right. And most of the, I mean, there are always ups and downs in life.
Oh,
I mean,
gosh.
we're all going to have things that don't go our way, or we feel, slighted in some ways. But this one goes beyond that, because most of the time, when something doesn't go your way, you have a reaction to it. You start thinking about it. You put it in context, and you find a way to kind of make that okay and resolve the issue.
You work through it.
You work through it.
Yeah.
That's a
This is
typical
kinda
way
the
to
way it
talk
goes,
about
yeah.
it. And I think the people we're talking about here don't quite have that ability to do it. In other words, they're looking for things that fit in, and an assumption would be that you're out to get me, or you're trying to insult me or trying to hurt me, and then therefore I know now that that's true when the evidence may not be there.
Right, but because they're looking for it, they interpret it through that lens, then they see confirmation of it in their own mind through interactions and.
Right, and it builds up over time as well. So the part of the definition of a personality disorder is that it is ongoing and long-term in nature, across situations, across people, and so this takes place over a longer period of time. So there may be this accumulation of these kinds of issues as well.
Now, didn't you also mention there that there's a tendency to get back at or have retribution due to that slight that they felt?
Right. I mean, if
Like
it's
we're built, we got a list here.
well, we might be making a list there. But if they really feel insulted and slighted by others, then there's this tendency to feed the facts in to make them fit into this, and so it may be that this carries over with other people. You may be the next victim
Gotcha.
in this situation as well.
That's what I was wondering. Okay.
Let's take a look at that next slide, the slide that we had up just a moment ago. This one talks about intimacy, intense, unstable, and conflicted close relationships marked by mistrust, neediness, and an anxious preoccupation with real or imagined abandonment. Now, stay with that one for just a bit. Now, you also, we'll get to this next one, the next part of this in just a second, but let me talk about this idea of the preoccupation with abandonment.
Okay.
Because I think really there can be real abandonment.
All
it talked about real or imagined, but there can be real abandonment, because if you are the person who has this negative outlook, dealing with that anxiety by blaming others and getting back at people and doing those kinds of things, then you may really, in a realistic way, push people away from you.
Okay.
So you
So
and
there
thus
could be
becoming
abandonment.
isolated within your workplace,
Right.
and almost becoming a self-fulfilling prophecy. As you become isolated, it confirms to you as the individual that people are out to get you.
Yes. And if
not
you're
on your team.
exactly, and if you're not open and honest with your communications with others, if you're not working within a team and in a group, then what happens is that continues, and you don't get feedback to sort of self-correct
Okay.
in that way. You believe it's true when it's not, and therefore you kind of continue this pattern of interacting with others.
And I could see how in a work environment this could not only happen among peers who are at the same level, but
Right.
it could happen, you know, with management at a certain level,
Oh,
and
absolutely.
the people that work for them on their team or in their group or something.
Oh, absolutely, and for me, that's a very dangerous place,
Okay.
because these are people in authority, people who are making decisions about your life and how you manage your work schedule and all of the tasks and things you have to do at work. And if that person's in an authority position, they can make your life a little more difficult. Let's just put it like that. Or even a lot difficult, because they can't restrain and they can't manage these kinds of emotions.
And we're going to go back on that, the impact on others, after we've clarified what this is.
Yeah,
right?
I do want to say one more. That last slide that we put up, I think, is important. Just the last piece of it, and I wanted to go back to that, because this is almost this is a well-known symptom of the borderline personality disorder, and that is that relationships are viewed in extremes of idealization and devaluation, alternating between over-involvement and withdrawal. So this is the notion that the borderline may understand in their world, that they have a very close relationship and everything's wonderful, and all of a sudden days go by and now it's a terrible relationship and you're the problem, and so forth. So we talk about this. We talk about this in our counseling program when we're covering these categories. That you may get a client who comes in and in a very short amount of time, they call you by their first name. They feel they're talking as if we're very close
buddies.
and we're buddies, and we have a much longer relationship than the first 2 minutes that you've met them. And everything's wonderful and it's idealized to a point that, wow, you know, this is going to be great, when over a period of time, the reverse happens. You are not the person I thought you were. And so if you think about that for a minute, that the person has these relationships that tend to run hot and cold often, and cycle between we're good friends and now we're enemies.
Now I hate you.
That's right, those kind of things. That's a very difficult place for you to be on the other end, on the receiving end of that. And so I'm fascinated with that notion.
I hate to stop you, but we're going to take a little break.
Okay.
Okay. I'd just like to remind you, you're watching Education Forum.